Hello, I'm Dr. Walker-Barth. I started Cats Exclusive back in 1981, and my goal back then was to provide an environment for cats that was nurturing and that allowed us as veterinarians to see them in an environment that minimizes their stress, and as well, me as a veterinarian, to learn all I could about one species. And today we're going to look at Sophie, and she happens to be my 18-year-old and one of 3 cats at home. And we're going to go through, and I'm going to talk you through an exam, and much of what I will tell you are things that you won't be told during our exam because we're looking and thinking at the same time, and much of what I tell you will take longer to tell you than, in fact, it will register when we look at it. For example, we do things in a systematic fashion. We record it on chart. We like to know what was there last time so we can compare it to next time. Because changes sometimes are critical as well. There are ranges of normal, and sometimes one end of a normal and just changing still within normal might suggest something to us. So, and that weight is a good one for that. So we'll start at the front end, the eyes, and we first look at eyes, or at least I do. I close the eyes first, and then I open them, and what has happened is they will dilate when they're closed, and then they'll constrict a little bit more when I open them, and so I can watch the pupillary response to light, which is just a subtle thing to do. Then I look at the eye itself. I look at the eyelids for the margins being normal size and shape. They don't roll in or roll out. I look at the colors of the mucous membranes. The conjunctiva should be a certain pink color. Other things will show up in there as well as anemia, liver disease, icterus will show up. You look at the white part of the eye, the sclera, and you look for the vascular patterns there. Sometimes you'll get an engorgement of vessels that will tell you that there's a deeper problem inside the eye. And then you look at the iris itself just for its shape and color, and in an older cat you're going to see a punched out appearance, and that punched out appearance will often, well, it's normal in an older cat actually. And then you look for pigment. There are freckles that are seen as, particularly in red cats. Orange is the color most people call them, but actually they are a red cat. And in those abnormalities can sometimes aren't just a normal abnormality, but might indicate a melanoma. And then you look deeper into the pupil, and you look at the size of the pupil, as we indicated earlier. You look through the pupil, through the lens, and in an older cat you'll often see something like Sophie's got called lenticular densities, and they look like cataracts, but in fact they're not. They usually start at about 10 years of age in a cat. I will often take my pen light and do something called transillumination, which, if we can talk Sophie into keeping her eyes open, allows me to look back in the deeper parts of the anterior chamber of the eye. We have special equipment to do that when we really need to visualize that well. It also lets you see the contour of the iris, which is important. I take an ophthalmoscope, and then I go way back into the eye, look at the retina, and those areas are important, because you look at the vascular pattern, you look at the size and shape of the vessels, you look at the back of the retina to see if there are any punched out areas, you looked at the optic nerve, and have a look at that, and all that looks fine. You can do a more in-depth ophthalmic exam, and that requires some dilation of the pupil, but most of the time we don't need to do that, and most cats, as you can see, put up with it quite well. And Sophie, of course, knows what she can get away with me, and so she's going to push me a little further than she might somebody else. So then after eyes, we look at ears, and the ears should be clean. They shouldn't be any warmer to touch than, say, the rest of the body. Always do a little scratch here, not only just to let the cat know that we're here to give him some love, but also the amount of sensitivity is important. So you look at the wax content. Usually you don't see anything abnormal. On the outside, you go further down with an otoscope. We have a look all the way down the ear canal of the cat's L-shape, so we kind of go around that corner. We look at the tympanic membrane or the eardrum, and that looks good. There's no bulging, there's no discoloration, there are no masses, there are no weird wax plugs, and in younger cats you often see ear mites. So we're through eyes and ears, then we look at nose. We look for moisture, any discharge, shouldn't be any. Kind of a wives' tale is that if a cat has a cold, moist nose, then they're healthy, and that's not true at all. So then we look at the mouth, and mouths are important. Some kitties, you can hear her purring actually, though she's pushing away, she won't stop purring. That's pretty typical for Safi. And actually we're very fortunate in our practice, because many of our patients are that way, because they don't have the stress of having dogs, sounds, smells, or sight. So again, looking at teeth, we look at the teeth to make sure they're all there for one. Two, that they're not broken, chipped. Broken teeth, if it's just the tip, usually aren't an issue. We would talk to you if we saw anything that was a concern. And then we look at the gum line for any inflammation to support periodontal disease or gingivitis. Again, we talked to you about the teeth. A little bit of tartar is not an issue. It's more the gum issue, the inflammatory process that goes along with that. So in the mouth, then, the other thing we do is I like to look way down as far as I can, have a look at the tonsils, which I can see on her fine. I also push under the tongue, I flip it up, I have a look under that, make sure there are no lumps or bumps, squamous cell carcinoma, some oral cancers or issues there, just like your dentist does to you when they look under your tongue and have you move it from side to side. So that pretty much tells me in the mouth everything is okay. Then I feel just the contour of the jawline. I go in between the jaw bones. I'm feeling the salivary glands. I feel up behind the ears, same thing. All this looks like we're just petting, and that's what we want them to think. I mean, that is really the key, is that through this experience that they think that it's all about fun. Again, we're lucky here because we get to do that a little bit more than most places can. And so then I feel down here, and I'm feeling for her thyroids, which is an issue primarily in older cats. It can start as early as 5, but average age of onset's 13. We feel for thyroids in her, and they feel fine. You're feeling as well going down her lymph nodes. Like I said, we start up here. Whoops, she says, oh, don't choke me, Dad, don't choke me. She says, I'll need a treat for that. And so then we feel her prescapulary lymph nodes in this area, that feels fine. We feel our axillary lymph nodes, that feels fine. Go back to the back legs, feel popliteals, those feel fine. We go to the inguinal area and feel that. And in a little bit we'll feel in the mesenteric lymph nodes when we get to the belly. Lymph nodes are important because they're kind of a drainage, if you will, site that tells us about potential issues that are going on further downstream. So now I go down the front legs. I like to feel for symmetry. Right side, left side feels the same. Go down, feel no lumps or bumps. You're feeling not only deeper, but you're feeling skin to make sure there are no tumors or sometimes warts. I mean, she's got a little wart back here, and that's not an issue. We look at the toenails. We try to make sure that we can pop them back out all the way, and we look at the beds for an inflammatory process. We look at the pads to make sure that they're not swollen or cracked. Both feet look good in her. She says, I got a tough life, I tell you. I never go outside, so there's really not much down there. That looks good. Again, we move back down the spine. I like to feel the dorsal processes of the spine. That tells me kind of weight. There shouldn't be an excessive fat pad. You should be able to feel back on her spine like you do on your own. And it should feel like just a little subtle ridges. Not too prominent, but certainly not buried. Same with the ribs. Should be able to feel them almost like that, not quite that much. And that tells you whether the fat pad is appropriate. Same over the hips. Even cats that are appropriate weights will often have that little swingy thing down here, and that's just the way it is. That's not a problem. So then once we've kind of done that, I go over the rib cage, feel all the way back the ribs. Again, now we get into the belly, and the belly's really there's a lot in here, and when we're talking to you, you might just see us poking and talking, but in fact what I first do is I slide my hand up under the right side here, and I feel the liver. I should just be able to feel the margins of the liver, the shape of the liver. Left side's a little harder to feel, so most I can't feel on the left side, and if I do, then it may tell me that I've got a problem that's going on in the liver that needs some exploration. So after the liver, I feel kind of the pancreas region, and that feels normal. I feel the spleen, and I can feel that, and see, she doesn't mind. I mean, she really does think it's petting. And then I get the kidneys, and kidneys are so critical in cats. I put the left kidney, I literally have the left kidney in my hand. I'll show you here. She says, no you won't. She said, no you won't. No you won't. You gotta scratch me. I gotta go pay for this. So I feel her left kidney, it's right there in my hand. I'm really feeling the whole thing. Same with the right, for size and shape. And they feel great in her, and particularly for an old cat. I feel the stomach, So now I'm going to go to the intestines. I feel the stomach. I take my fingers all the way through the small bowel. I'm literally kind of feeling the loops of bowel for thickness and consistency. Make sure there's no discomfort. You can get a cat that wiggles a lot, but if they have pain, usually you'll get a response that they're tightening. Then I feel the colon for quantity of stool, consistency of stool, and that all feels good in her as well. And as I said earlier, I feel the mesenteric lymph node. Feel that region, make sure it's not enlarged, and that all feels fine. So then we have a feel of the bladder. And bladders, she says, I'm getting tired. But again, she hasn't stopped purring, mind you. This is a talker. This cat has to tell you everything. She's the matriarch of our family. So her bladder feels fine. That all feels good. So then, again, a little bit of strokes to not only make her feel better, but finish what I'm feeling. And all this stroking as well, as we're moving the hair back and forth, we want to see if there's any flea dirt that pops off. And then I feel down her tail to make sure that feels okay. And then we go to the embarrassing part for cat. We have a look at the back end, make sure their urogenital area looks fine. I personally don't take temperatures on my normal healthy cats or the ones that come in that are eating fine, that are doing well. Because cats, it's an indignity, and I see cats who come in and they've had fevers or temperatures that are elevated, and it's really from the stress of the car ride, so it doesn't give me much information. So I don't do that unless they're sick. Now she's getting into the treats that we always give at the end, and she's getting her payback a little early. So then, once we've done the abdomen and felt all that, then I get my stethoscope. I like to listen to heart and lungs, and she says, I want that treat. She promised. So, heart's important. I take a rate. I listen for the rhythm. There should be a very consistent beat. You listen to the left side and the right side, because you hear different valves on different sides of the chest. And the problem here is that we often have our patients purring, which she's wanting to start doing right now. So if I don't get what I want and I can't hear it, then I take my finger and I put it over their nose like so. And that's my version to take a deep breath and hold it. It's about as close as we can get, but it works. And she sounds great. So we try to get a weight on all of our patients, which for time's sake I'm not going to do. We do a flea comb as well to see if, in fact, there's any flea dirt. Being an indoor cat, she better not have it, but in fact they do have it sometimes because they can come out on your shoes and just through doors. That pretty much wraps up our normal physical exam. There are certainly things that we do in more extreme cases. We'll do neurological exams, and as I spoke earlier, we'll do special eye exams, and we can go on and have ultrasounds done, but all of that's done only when indicated. I hope that this enlightens you a little bit about what we're doing when we're feeling here at Cats Exclusive. If you ever have any questions, want more information, certainly give us a call. Thank you. Bye-bye.